Audrey
Thank you very much.
Okay.
Thank you very much. I'm sorry because I will have to leave at 3:55 sharp. So she said, if you're okay, I will do the first keynote.
That would be
Yes.
fine.
Thank you.
Okay. Can I just share? Is that okay?
Yes, you can go ahead and share your screen.
Okay. Hop là. Let me share. Did it work?
Yes,
Do
it
you see
did.
the screen?
Yeah, we can
Do you
see.
see my screen?
Can the delegates see the screen? Go ahead and show some thumbs up, some emojis if you're able to see the screen. Everyone seeing her screen? Yes. Mohammed, yes, they can see your screen, Dr. Ngunju.
Okay. Super. So good afternoon, everybody. My name is Dr. Audrey Flangam-Sik. I'm an expert in climate change. I'm working with companies to help them integrate sustainability in their operation. And also I'm an advisor for the Brussels government and for some think tank. So today we're going to see how climate change is a catalyst for inequality in social determinants of health. What if the zip code you're born in become the most critical predictor of your health and also survival in this time of climate change? Massive storms, flooding, extreme heat, droughts, air pollution, wildfire, the pollution of the food, the pollution of water. In one word, global warming and the changes to climate that come with it. They provoke extreme weather events that have drastic immediate impacts on health. And the worry today is about these extreme events happening more often. Our physical and mental health both will suffer, and some populations are more vulnerable than others. To be short, climate change is making us sick. For example, increase in temperature provoke air quality being worsened, and that increase asthma in people. Increase in airborne pollutants and allergens provoke more allergies in people. And so we have a scope of disease from respiratory disease to cholera to malnutrition to Lyme that are provoked by climate change, by the extreme weather event of climate change. But it affects our physical health, but also our mental health, because people who had to go through an extreme climate event often have PTSD, depression. In worst case, they commit suicide, and the one who are scared of it are more stressed or climate anxiety. The data from the World Health Organization says that 400,000 deaths are due every year because of climate change, and the number is predicted to grow to 700,000 by 2030, and that will cost almost 3% of the global GDP. So, climate change is not only an environmental problem, it's a public health crisis. And that brings social consequences for vulnerable population, for employment, for education, and of course for health. And today, let's talk about health. So think of your health like a house. While doctors and medicines are important, just like repairs and maintenance, the foundation of your health is built by your daily life experience, and this experience starts from the day you're born and continues throughout your life. Let's meet Sarah and Mike. Sarah has a steady job that pays well, allowing her to buy fresh food and live in a safe area with parks everywhere. She has time for regular checkup and can afford them. And when she's stressed, she has friends and family she can talk to. Mike, however, works 2 jobs to be able to put food on his plate at the end of the month. He often skips doctor visit because he can't afford it or he cannot take the time off work. His neighborhood has not a lot of grocery stores, way more fast food restaurants, and it's cheaper. And he's often too tired to exercise and wakes up at night because of financial worries. So that shows that your life circumstances can shape your health, meaning who you are, age, sex, genetics, what you do, if you smoke, if you exercise, if you drink a lot of alcohol, or if you can have healthy diet. And also the condition in which you are born, in which you grow, in which you live, in which you work and age, meaning your social and community networks, your socio-economic network, your cultural environment, the environment also where you live, and your access or not to the health system. So the social determinant of health are shaped by the distribution of money and resources at national, international, and local level, and they also influence the health inequalities. That means the unfair and avoidable health difference between different groups and different people, between countries or within countries. And the social determinant of health are of 5. We have the money. Do you have enough money to live? The education, the access to doctors, a safe place to live, and a supportive relationship around you. And those social determinants as important, if not more important, than your genes or your medical care. So when someone gets sick, we often focus on their symptoms and treatment, but preventing illness often means looking at these bigger pieces of life puzzles. Can they afford healthy food? Do they have time to exercise? Can they see a doctor when needed? Do they have people to lean on during tough times? The story of Sarah and Mike help us understand a bigger truth. Health differences between people often aren't just about personal choice or bad luck. Instead, they're like a domino effect that starts with how society is organized. Look at this map. It is the life expectancy around the world. If you look at Nigeria, it's 54.5 years old. In Australia, it's 83.9 years old, meaning almost 30 years between those two countries. In Australia, there are differences. If you look at non-Indigenous Australian women and Indigenous Australian women, you have nearly 10 years between their life expectancy. And in the same group, you have a difference between white collar and workers. You will have a difference between migrants that have to flee their country because of war or climate change, and the people who will stay in their native country. So let's go back to Sarah and Mike. The same way, if you live in a neighborhood where fresh food is scarce, where gyms are expensive, and the air is polluted because of all the factories, and if you don't have enough money to be able to live an easy life, like Mike, or if you are like Sarah and you can afford fresh food, go to the doctor, live in an area that is peaceful and safe, and have friends that can support you, who do you think is the most likely to be healthy in life? And scientists have discovered that these life circumstances, so the social determinant of health, are responsible for up to 2/3 of your health outcomes. So if you look at Sarah and Mike, now imagine that there is a heat wave in their neighborhood. Which one will be able to cope the best? Sarah lives in an area where there are plenty of trees for shade. Her home has good air conditioning and she can work from home when there are very hot days. Mike's situation is different. His neighborhood has few trees, making it much hotter than other parts of the city. His apartment doesn't have air conditioner, so it is as hot as it is outside. And To work, he has to be outside. That means that he has to choose between his health or losing money because he cannot work because of the heat. The same pattern appears with other climate impacts. When floods occur, people with few resources often live in more vulnerable areas and struggle to recover from damage to their homes. During droughts, rising food prices hit hardest those who are already stretching their budget. And poor air quality from wildfire affects everyone, of course, but the one who can afford the air purifiers will cope better than the others that often live in the more polluted area. So it's a domino effect. Climate change takes existing inequalities in housing, income, healthcare access, and job flexibility and amplifies them. Those with few resources not only face greater exposure to climate risks, but also have less ability to protect themselves or recover from disaster. Let's go back to Sarah and Mike. The different life situations show us something crucial about climate. When extreme weather events strike, their impact aren't felt equally. They're like adding weight to an already unbalanced scale. This is why the United Nations said 5 years ago that climate change is not neutral. It reinforces systemic inequality that already exists. And social determinant of health explains why. The good news is that we can change this story. Just like we can improve a garden by addressing its environment, we can make our communities healthier places for everyone. This means thinking beyond just building more hospitals and hiring more doctors. It means creating good schools, ensuring everyone has access to healthy food, making neighborhoods safer, and creating job opportunities that provide stable income. When we work together to make these changes, we're not just helping individuals, we're building a fairer world where everyone has a better chance at good health. After all, shouldn't everyone have a fair shot at living a healthy life? This understanding helps us see why addressing climate change isn't just about protecting the environment. It's about creating a fairer society where everyone has the resources and support they need to stay healthy and resilient in a changing world. Just as health isn't just about medicine, protecting people from climate impact isn't just about reducing emissions. It's about ensuring everyone has the means to adapt and thrive. Thank you very much.
Thank you, Dr. Mgumzik, for such a great presentation.
Our presentation. I think one.
Chitundu, yes, you can go ahead with your remarks.
Okay. I was just about to say that one of the things that I really loved was how in your presentation, you said life circumstances can shape your health. And I believe this is something that, we can easily overlook. So thank you so very much. I just want to see if there are any in the chat. I don't know if you have a minute or two to spare just to answer a few questions from the delegates before you head out. Okay, does anybody have a question for Dr. Audrey? Even as she's just about to leave the call. Okay, so we do have a question, Dr. Audrey. I don't know if you're still with us.
Yeah, I'm still here.
Awesome. Okay, so we have a question from Juliet. So Juliet is asking, how can healthcare systems around the world adapt to the growing health impacts of climate change, particularly in vulnerable populations, and what role does innovation play in addressing these challenges?
Yes. So I'm going to start with the end of the questions. So now you have people working on AI and to be able to predict when these events are going to happen. Okay, that means that they can say, for example, in that area, you cannot grow tomatoes anymore because in 5 years, the soil won't be healthy enough. So you have to grow it in another place. So that means that at the same time, they're able to help the population to move, to not be hit at the moment what is going to happen. If you've seen what happened in Spain a couple of months ago in Valencia, the people are very angry because it was predictable and nobody did anything. Okay? And so technology can help us to have already for the food security, to make sure that we eat nutritious food and that it's grown where it will have nutrition. About the health itself, it's really to be proactive instead of reactive, meaning be able to see before it happens that you're having a asthma problem or health problem or something like this. So voilà, technology today is more used on the environment to be able to displace people, to grow food in different areas where it will be more successful in the coming years. But it can also be used to be able to know before it happens that you're having a heart attack, for example, or that you will have respiratory problem, to be able to fix it before it's too late.
Really love that response. They say prevention is better than cure, you know. So I really love highlighted that. And I hope, Juliet, your question has been answered and you are satisfied. So I'll just take one more question because we're running out of time. So we have a question from Hanson. Hanson is asking, what can our communities do to support climate change actions?
So first of all, it's a very good question, I think. So you need to understand that to be able to adapt to climate change, we need to have the perspective of everybody. And often the people who take the decision are all the same, meaning the one who are the leaders of today. But what we forget is that if you solve a problem for the one that nobody talks about, you solve the problem for everybody. Okay? So in your city, in your area, you definitely need to talk to have all the perspective around the table. When you have that, you see that the solutions that are found are way better. For example, to caricature, you just had a flooding in the city and you have only men sitting at the table that have been in the same school, whatever. And they will fix the problem in a short term. Well, when you have everybody, they will actually displace people in the place and help to rebuild it so that they're not flooded again. If you look at what's happening in lots of cities, people stay in where they are and they are flooded years after years after years, which can be prevented. But it's because not all the perspectives are there for the decision making. So if you are in the position of decision making, make sure that you listen to everybody in your area to make a decision and not only to a few.
Thank you so much, Dr. Audrey. Hanson, I hope your question was satisfied. I actually love that response because, you know, it's actually easier for you to deal with situations in your community because you're coming from that community. You understand the needs of communities. So you start from there. And, you know, to add on to what you mentioned, I think even looking for organizations that are dealing with, you know, climate change and the like, it's also another way to get involved because at the end of the day, the solution is not going to come from somewhere else. It's going to come from you. So thank you so much for that, Dr. Audrey.
Thank you very much. And
yes.
I'm going to stay a little and then I will have to go, but thank you.
All right. Thank you so very much. It was so great to have you, Dr. Audrey. At this point, we can excuse you, and I'd just like to invite our another keynote presenter who will just take us through a presentation. So I'd like to go to the platform, Pira Sial. Pira is an environmental chemist at Sinda Environmental Protection Agency. That should be the government of Sinda in Pakistan. So Pira, are you ready for us with your presentation?
Yeah. Hello, everyone. I hope I'm audible to everyone.
Yes, you are.
Hello.
Hello, I hope everyone is fine. And thank you so much for giving this opportunity to be here and give my presentation and my views on how the climate change is affecting our health and whether the mentally or the physically. So let's start the presentation and I'm going to share my screen. I hope it will be visible. Okay, so can you see my screen?
Yes.
Yes, we can.
Yes, delegates, just show some emoji, thumbs up, fire, some love, so that we can know that you're able to see the presentation, please. Thank you.
Yeah, thank you so much. So let's start the important topic, which is about the climate, how the climate change is affecting our health. So before going to start the presentation, let me introduce myself. I'm Trace Yar from Pakistan, and I'm working as a civil servant, or the designation in which I'm going to work. I'm working as an environmental chemist with one of the provisional department, which is Sindh Environmental Protection Agency. And we are on a daily basis, we are working for the betterment of environment, and we are ensuring that everyone could have a safe environment, whether for present generation or for the future generations as well. We are making the policies, we are making the kind of laws and the rules and regulations for everyone. So whether they are in home-based industries, whether the factories or every other thing which is contributed in the pollution of the environment or the climate change as well. So let's start today's presentation with agenda. So these are the agenda of today's presentation, which I'm going to cover one by one. So let's start with the introduction. What is climate change? How the climate change is slowly affecting us, and if the climate change cannot be controlled nowadays, it will be affect future generations or the or the people which are not born yet, because we know that the climate change is not only the weather patterns, but it is actually affecting us on a daily basis. Like, for example, we think that it is affecting on another country and it can never affect my country. Like, for example, my country, Pakistan, is surrounded by 4 different countries, and we have a 4 border with different countries. And if we are saying the neighboring countries are affected by the climate change and our country cannot be affected, it is a kind of a false statement. So it will be never affect the climate change, or it will kind of a false perspective or the thinking, because everyone is slowly and gradually affected by the climate change. And climate change is not only the weather patterns through which we can say the highest rainfalls and the temperatures, or even we have seen the different patterns, repetitive patterns of the environmental and the climate changes is affecting. But how these repetitive patterns of weather and the climate change are affecting the human health? Like, for example, I'm going to give an example of my own region. In 2020-22, we have seen drastic changes in the climate change, which is completely disaster kind of situation has been occur in my situation, in my region. How is this? Like, for example, we have the repetitive situation from June to the September, and in this last 2 years back, we have seen a heaviest rainfalls, and due to those heaviest rainfalls, we have seen a different kind of health issues, like the pregnant women has been affected more, or even those kind of the like, for example, we can say a kind of problems has been occurred which cannot be seen previously. Like, we have seen a malaria, but from that malaria situation, we have seen another kind of the allergy kind of situations we have seen, because these are the slowly and gradually affecting us. And this is all just because of the patterns of the climate changes. And this climate change and environmental issues are not just has been occurred within one day, but there has been repeatedly from last 20 or the 30 years they are affecting us. And those last 20 and the 30 years effect has been occurred in nowadays, and everyone is affected by. And if we cannot control nowadays, it will be affect our future generations as well. If mostly the pregnant women, like I'll give you the example, we have the World War I and the II. Over there, the chemical bomb has been used, and over the newborn babies has been affected by such chemicals or other things. Similarly, the climate change environmental issues are kind of a silent bombs as well. They are affecting us, but we cannot see, because we are thinking like it will affect our future generations. Future generation is not here. If the present generation cannot be here or cannot be secure their future, so how we can protect our future generations? So we are the one, we should protect ourselves, then we think about our future generations. And how the repetitive modes that affecting like for example we have rising temperatures which are also related to the heart diseases, even brain hemorrhages and heart diseases are also occurred by this highest temperatures. Like the most common example I'm giving you in last October, which is the winter season we call in mostly countries, but in Pakistan we have seen a 48 centigrade temperature in Pakistan in last October. Sorry, the last one was the November, but uh, in October we have seen a 48 centigrade temperature. Even from June to the August we have repeatedly seen a 49 centigrade, 50 and even the 51 centigrade as well. So how you can see if the people are not habitual of bearing such temperatures, the most commonly affected by the kids, women and the elderly men or the elderly women as well. So they are slowly and gradually, sometimes they have the brain hemorrhage, heart diseases and even the brain diseases as well, because everyone is going to go out and for the bread and butter they should go out, and even they are going out and they have no proper protections, they can be affected by such heaviest temperatures and the different weather patterns. We have seen extreme weathers, like for example we have the highest rainfall, it will be converted into the flooding situation. Most other people has been displaced their home and their everything is displaced. Even sometimes the villages are completely washed out, nothing remains. And due to this situation, even we can say a kind of fertilizers or human activities has been combined together, they will drastically occurring in a different situations in which we have seen a kind of different kind of problems we have seen related to the health issues. Then we have the air pollution. Like factories are major contributors in air pollution. Because of the air pollution, you can have asthma and even different skin diseases as well, skin allergies as well. So these are the factors. Even ecosystem has been completely disturbed us, because we are just only talking about the human health, but it is not true. Human health is not only affected, but all the living organisms, whether the plants, whether the aquatic life, or whether on the land or inside the sea. Everyone is gradually and slowly affected by this. Because just because of the climate changes, we can't see those fruits and the vegetables which was our forefathers or even the parents has been seen. But we are only limited to the some kind of vegetables and the fruits as well. But our body needed a kind of different healthy food diet in which you have all the carbohydrates, proteins, and other things as well. So how we can say that how these climate changes has affected on our vulnerable communities, because these are not only affected because they can also affect on a low income communities. If their villages completely washed out, how they can survive, even they have the seen different kind of the problems and the health issues, how they can earn money and then think about their future, their kids' future as well. Even marginalized communities or also the small island communities has been affected by this as well. The example I'm going to give you, the sub-Saharan, in which you have seen a malnutrition and droughts. Like in some kind of the situation, you cannot grow the different vegetables due to the lack of the water and due to the different other impacts as well. So due to this reason, the farmers cannot grow vegetables or other things, and just because of this, all the region is affected by the malnutrition and the droughts as well. Then we have low income communities that can also affected by the droughts, and even the air qualities or also different rainwaters and other things as well. Then we can see how we have to adopt the systems or the situations that can mitigate or adopt the climate threats. Because we cannot change the climate, but we can change the situation, or we can change the people they are contributing in climate issues. Climate has remained same. It was from even when the earth is created, everything is similar, but it is displaced from this situation just because of the human activities. So we have to reduce those human activities, and for that we have to create a resilience strategies, like for example to give a proper health infrastructure to the communities, and even we have given more knowledge and awareness to the people how they can survive in that situations. And even we have to train healthcare facility like the nurses, doctors, how they can give knowledge to this, because it is the doctors or the healthcare facilities are just not only after disaster they just went and then they have this they can give their healthcare facilities. Before the disaster, they should go to tell the people how in different situations they can survive, or not only themselves but their families and the other neighboring people as well. Then what will be the role of youth communities and the government organizations in this? Being a government employee and government representative, I must say we have to create a kind of policies that are beneficial for everyone. We must have a policies for the kind of factories or everyone that are contributing in a climate issues, whether in terms of air pollution, whether in terms of water scarcity or the water pollutions as well. Then we have to train our youth, and even youth is already trained because we have a gadget, which is a cell phone. Everyone has the cell phone. They must be aware of this, and they must be aware how their voice is important. They use this gadget cell phone to raise the voice because they are the one most affected, because other people has been living their life peacefully, but we are the one affecting one. Because our forefathers, our parents cannot see situation the one I'm facing. If you're from 15 to the 45 years old, you are the one affecting more, because this is your future. This is my future. If I'm not healthy, how can I survive and earn for my family as well? Then how we have to we have to arrange sessions for the community level as well. We have to give them in knowledge to the communities, which we can say which fertilizers or the which different perspectives are important for them they should use, and how much fertilizers or the other things that can be used for the different crops or other things as well. Then on a government level, we have to ensure that the government can also make a policies for those people or even the factories that are contributed in the environmental issues as well. And even they can also make a policies for the hospitals and the healthcare facilities. They must have a 24 hours kind of situation. And whenever they can, people are call, they can emergency, because emergency, I have no idea. In developed countries, they have the 24 hours medical health facility. But in the developing countries, including my country as well, they have the less facility, 24 hours facility as well. And even if you are just waiting for the disaster condition and then you can take an action, it is not a good way. Because if you want to protect your people, you have to not wait for the disaster. You have to protect your people from the disasters. What will be the innovative approaches that we have to use to mitigate and adopt for these situations? For example, the future, we are the future. I'm repeating this. We are one. We have to create an AI situation, and even we have to create an application that can detect the situation. Even like, for example, I can say this, the people can make an application which can detect where can be environmental issues and the climate issues can be occur, like the water scarcity, air pollutions as well. Then we have another step that we can take, that is the solar powered hospitals and in remote regions, because remote regions, even they do not have a healthcare facility. So we must have a healthcare facility in the remote areas, and that should be completely on a solar system as well. Then we have a community-based adaptation programs in which the disaster drills or the preparations can be occurred, and every people can have a already knowledge that how they can mitigate or how they can face that situation. They already aware of this, because sometimes what happen in sudden situation, you have a flooding areas or other things as well, they cannot fully aware of it. So in that situation, in a hurdle as well, they just not only affect their self but their families or the kids as well. So we need to call in action like the sectoral or the collaborations are needed, because just on a local or the national level, it is not important to just you call out and one country is only taking an action and other countries are just contributing in climate changes. We all are must together. We have to sit and we have to employ those laws and the rules and the regulations for those people or the companies or the factories which are contributing in this. This is a international and in this, just not a national or the international organization, business communities can also come forward. The NGOs can also come forward. The healthcare facilities. This is not only the kind of a healthcare facilities problem. Everyone can sit together to have a laws and the regulations for the everyone, because we have to think about our future. If present is not secure, the present and the future will never comes. And the message, okay, so we can also say that the what kind of this facilities, because we have this everyone can sit together, whether the government organizations, environmental scientists, the importance of the environmental scientists in this, because we have to give in solutions for the problem. We are just giving in like highlighting the problem, but so that's why everyone should sit together, just to highlight the questions, highlight the problems, and also give the solutions as well. So the conclusion of today's presentation, like we have, climate change is not only the public health emergency that needs an urgent action. Even the resilience to the health systems and equity-focused policies, innovative solutions are really critical for these situations. And in this for the whole presentation, I'm just giving and closing my presentation with this. Like, this is my message to everyone. Protecting health is in a changing climate is not an option, but is also a necessity for everyone. And we are the responsible, because we are the contributor in the climate change issues. We have to secure, we have to give an ideas and the solutions to go where the climate issues has been occurred. And thank you so much for giving an opportunity to be here and sharing my ideas, because being a government employee and a representative, I must say we are little bit going forward for the betterment of the environment, because I believe minor impacts, minor efforts are having a major impacts, and we are waiting for that major impacts. Thank you so much for giving this opportunity.
Thank you so much, Pira. That has really been an insightful presentation. It's been comprehensive. You've highlighted so many things. You know, I was about to ask you a few questions, but now it's like your presentation literally covered every question I could come up with. So thank you so very much. That was, I really enjoyed this presentation. Do we have any of our delegates that has a question for Pira before she's excused for the platform? Okay.
Yeah, why not?
Pira, we have a few questions for you. So we have a question from Lukman. So Lukman says, rather he's asking, my question is, what advice do you have for individuals whose health is affected by climate change?
Being an individual, I can say that climate change has majorly impacted me, because I just give an example in the start of the presentation. I belong to the area which is completely remote area, where if even I can say a 5 millimeter of the rain can completely affecting us. Everything is damaged, whether the education, our home, water scarcity has been occurred, because if you cannot get a fresh water and completely secure water, how your life can be survived. Being an individually, I can say that climate change has affected me, my people, my family, and even my region as well, because I'm belong to the one of my province, which I can say this is the Sindh region. This is the one of the most affected by the climate issues, and I have seen my own eyes how the climate issues just is not about the air pollution, not about the water pollution. It is a completely health issues. I have seen kind of a diseases and kind of situation which is just only occurred by the malaria, because over there you cannot imagine what the situation are people going to go through this. We have never seen kind of a diseases before, even we cannot read in a books as well, but now just because of the climate change we have seen such diseases as well. The people having this such diseases, even the pregnant women getting depressed in such situation, how the baby can be healthy for this. before born, baby can also be affected. The baby's heart, baby's brain can be damaged by just in a such situations. If mother is not healthy, how the baby can be healthy? So this is the situation we are going through, and this is not just only at 2020, 2022. In every year we are facing this. If not from the flooding situation, but from the heaviest temperatures as well. Just now I said 51 centigrade is unbearable. Elderly people are affecting one. If you are going to go in early morning for the bread and butter, to earn bread and butter for your family, and you cannot come alive, because everyone is facing this situation. You are going in around like around 2 p.m. in one of the most afternoon situation, and you have affecting in your brain cells can be damaged such temperatures. So this is everyone is affecting. I'm not talking about just only Pakistan. I think every developing country has the same situation.
Yeah, that's definitely true. And just to add on to what you had mentioned, Pira, I think, you'd be so surprised at how many people don't actually know much about climate change and how they relate with health. So I think from an individual perspective, for example, Lukman, you are currently in this meeting, right? And you're getting all this information and all this insight concerning climate change and health. And so I think for somebody in your position, you have access to a phone, right? So you can easily spread awareness, concerning the climate change and the like, because at the end of the day, collaboration here is key. The more people know about this situation, about climate change and how it affects your health, the more strategies you can come up with, the more ideas that will be developed along the way. Because in as much as it's something that's currently rising, there's still so many people that don't know about this topic. And so I think even from the individual's perspective, we can also just take a stance and, have more people know about this particular subject. So I'd just like to ask the last question, Pira, just before we end. We have about 4 minutes left till our session ends. So we have a question from Chinwendu, and Chinwendu is asking, my question is, are there first aid measures for pregnant women in a polluted environment because most persons don't have access to healthcare, which has given rise to metabolic disorders of the newborn?
Can you please repeat the question? I'm so sorry, I couldn't get it.
All right. So the question is, are there first aid measures for pregnant women in a polluted environment because most persons don't have access to healthcare, which has given rise to metabolic disorders of the newborn? I hope you got the question, Pira.
Yeah, I got it. Like I have given you example, like previously, even my forefathers and even everyone's forefather don't have one of the graduated doctors in their region as well. On that, we have the kind of a herbal people that can have that situations that can mitigate in this way. If the pregnant women can be affected by the climate changes or in a climate situations, they can consult like I have no specific word for this, but in my region, we have the women that are mostly come on the kind of period where the women is in a pregnant situation. They're just coming, then giving a kind of a herbal, the teas or the herbal medicines. So they can also go through this. But now I can say this due to the cell phones or due to the awareness and the knowledge, whether in a lesser, but I cannot say they are completely unaware of, or I cannot say anyone uneducated, but they are the unaware of these situations. But since the cell phone has been arrived in our life, everything has been easily for us. If you have a cell phone, you can call your doctors, and even in a like in your situations, I can say you can consult your doctor, or sorry, consult your government organization. Ask them you need your doctor in your regions. We are also providing a doctors in the remote areas or the developing areas as well. So if the women, pregnant women or other elderly people are affected by the climate change, you must consult those people which are having a little bit knowledge about, they are not the doctors, but they have a little bit knowledge about the health facilities as well, because now everyone is a graduated and they have the full degree related to the healthcare facilities. But previously our forefathers and our parents has been like, they are also fully aware of it. But as I told you, you just ask your government, they must have a hospital in this. If they cannot hear, use your cell phone, use your voice, everyone can hear you.
All right. Awesome. Thank you so much. So we do still have a few questions, and I've just been notified that we do actually have extra time. So just before we head into our next presentation, allow me to ask the final 3 questions. I hope that would be fine. Okay. So we have a question from Faith, and I'll merge these 2 questions because they seem like they're similar. So we have a question from Juliana as well as Faith. The question is, oh, pardon me, from Bue. I really hope I'm pronouncing your name right, James. Yeah, so what are some successful youth-led initiatives in Pakistan? And even as you're giving us examples of a few successful youth-led initiatives in Pakistan, how can we adopt solutions to a climate change affecting health? Just to say, in my region, I think this is an example. So just to say, in my region, there is outbreak of laser fever. So how can we bring solutions to, I'd assume the Faith is asking to her region, with the awareness, with the awareness, we still come down with it. So
Yeah,
I hope you.
Yeah, I got it. And thank you so much for asking these questions. Because if you have raised the question, you have willing and the hopes to do something for your region as well. I'm really thankful to raising this question. And I'm going to answer this because I have seen a youth lead organization that are actively working in Pakistan, even in developing regions as well. What first you need to take an initiative to make a change? Just you have to plant the more trees. More trees plant that can also change the situation even in your region as well. I'm not saying just planting 10 trees can change the country's situation. Never. In Pakistan, on a government level, we had in a previous government in 2019 and the 20, we have a million tree campaign over there. In whole Pakistan, we have planted more than million trees. But on a regional level, I'm going to give you a successful example. One of my students, because in my department, university students are coming in summer internship, and for the winter internship, what they are doing, they on itself. Sorry. So they are itself taking initiative to raise the awareness to plant the trees, whether in a universities, whether on a road by roadsides, or even in the villages as well. First, you need to plant more trees to initiate to make more awareness in your regions about the climate changes. Even I have given you example of, if you are more in an engineering side, you have to create an application related to this, like the GIS. You have got an idea how the GIS is working. GIS just is not about the mapping, but you can also take an idea which region is more affected by the climate changes. Then you should start from giving an awareness in schooling level as well, because these kids, whether they're from 5 to the 10 or the 15 years old, they are the one are most energetic. They wanted to do something for your country, for your people as well. You can aware them how they are using. And most example I'm giving you, like in one of the schools, one of my student has went and raised the awareness related to the plastic pollution. Over there, he asked the students cannot use the bags. You just use the clothing bags, and on a repetitive mode, you can use those clothing bags. So what happened is, to all the students went to the home, they discarded that plastic bags, they immediately using that clothing bags. So this is the initiative you have to learn, you have to make an awareness in the region. Secondly, if it is about an healthcare facilities, just plant the trees, raise awareness in elderly people or in a young women and the men. Just tell them how they can mitigate, how they can take care of their self in their in their region as well. And how they are doing this, you just prepare them. They must have a kind of a confidence, or even they have fully prepare of everything. They are just like this is not the situation like the flooding is coming, because every flood has affect first city, then the second city. You can already aware it, because if the water is in my neighboring city, you can already aware it. If it is there 5 kilometers away, of course it will come near to me as well. So in this situation, you can confidently take in kind of a dry fruits, the dry cloths, or even the baby products, or even the hygiene products as well with yourself. You can go to that area which is prone, or you can say which is safer than that area. Everyone is doing this. Even in 2022, in my region, those young people has more contributed in these flooding areas to like evacuate those people from that flooding situations and goes to the safer areas. Even the doctors are coming forward in this. But I can say this healthcare facilities cannot do anything, because these are not the angels. They are angel to do a work, but they are not an angel to do everyone's work. So all the people, all the organizations, whether the business, non-business, NGOs, government, everyone should come forward. Most importantly, the youth can take initiate in this. Use your cell phones to raise your voice, to give your government organizations a problem. They will must give you a solution for this. I hope you can get the answer.
I believe you have answered quite well, and I believe our delegates are satisfied with the answer. So thank you so much once more, Pira, for that amazing presentation, for your responses to the delegates' questions. We've really enjoyed this presentation, and at this point, I believe we've come to the end of your presentation, and we can just get on to
Sorry,
the next.
just a second, please.
Okay.
Hi, I have one more question for for Pira Misael.
Yeah.
It's from the chat as well. Musa, it says, how can we find solution for some of these chemical substances being used by farmers to treat their crops? I think that's a really great question. Do you have any solutions that as the alternatives instead of the very harsh or harmful chemicals? Are there alternatives that could actually be used to mitigate?
Yeah, exactly. What happened in this situation? Like, for example, before the production of the fertilizers, our forefathers and our parents were used, or even the farmers were used the natural fertilizers. In this, you can use a cow dung, even the rice husk, everything is there. But if the people are cannot relying or using that natural resources to grow the crops, of course they can use those people. Because what happened in this situation, I told you, climate change is not just in a 5-day situation. It is like the past 30 and the 40 years. What happened, the people are kind of habitual for this. If the something is takes 30 days to grow, they are using, or they are taking a short term in, or the short ways. Like if something takes a 30 days, they are going forward to the 10 days. They are using more and the more fertilizers in this situation. So what happened, you can use your awareness in those farmers as well. You can ask them to go those or you have to put, or you can also get an idea how the previously farmers were using this situation. And one more thing is that it is not about only the farmer's fault. It is our companies as well. Whatever the situation is, this, like for example, if we are saying, like I'll give you a womanly example. If in one of the region more clothes can buy, the people are always go to that to open shop there. So if in your region the like I can say, sorry. So I can say if in your region fertilizers can be more usable, you can raise awareness in your farmers to use cow dung, rice husk in that situations. It takes a time, but of course you will get a healthy food as well. And another thing, if there's a heaviest rainfall situation, you must have your farmers or the crops or the field, and the drainage system is another way, which cannot be mixed in your fresh water. If in a draining situation, if your drainage system is not good and it will be mixed with your fresh water, it will automatically, ultimately, it will affect you as well. So one thing, you can raise awareness in your farmers to use those. Even we have kind of those I can say fertilizers which are not 100%, but they are the organic fertilizers as well. You can go those organic fertilizers, you can use them. It takes the time to grow the crop, but it is beneficial for us as well. I hope you can get the answer.
I love that response. Could I just add on to what you have mentioned concerning spreading awareness?
Yeah.
Something that I have noticed is if you're to have a lot of initiatives that turn waste into resources. For example, you have your food waste. So in this case, the delegate asked for farmers, right? So if you look at
Yeah.
farmers and mentioned something about cow dung, and they're like, those are waste materials, right? And even the waste materials that they get from the plants, they can use all those waste materials to create biogas. And during the process of making the biogas, there's a byproduct which is organic fertilizer. So I think even as people are spreading more awareness about this, they can also spread more awareness about the biogas, process, because I believe it could also contribute to the challenge with the chemical spills and the like. So I just wanted to add that to what you had already mentioned.
Yeah, exactly. Because in word, because I told you everything is contributing in the climate changes issues as well. If we are wasting more food, why we are not giving an alternative ways to use that wastage of the food in a proper or the innovative ideas, like you have mentioned the biogas as well. And even the wastage of the food can also use for the growing naturally growing crops as well. But first, you need to give an awareness to the farmers, because just now I had been on a COP29 in Baku, Azerbaijan. I have also overtold them, because the farmers are leaving those old tactics or the old ways to grow the crops. This is not only about the fertilizers, they have the water scarcity, because we have seen wheat, rice, and the sugarcane are taking a lot of water. So what happened in that situation? The water is mostly uses and wasted in that waste. So ultimately, you can go to that fertilizers that are contributing in health issues. So of course, if the people are going to go this, and you have to make an awareness to the farmers as well, which fertilizers are better for them, whether the chemically or the organic one, because everything is not just like you have to grow in 10 days. It takes the time. You can go to those old ways which were the beneficial for human health and the climate as well.
Most definitely. Thank you so much, Pira. I see that we don't have any more questions in the chat, so I believe we can just move on to our next presenter. So I'd just like to confirm if we have Sarah Rashid with us on the call. Sarah, are you with us? And are you ready?
Hello, yes, I'm here.
Okay, awesome. So you could just introduce yourself and get into your presentation.
Oh, wow. Okay. Could you give me please 5 minutes, because I know that my time is on, I think, maybe 3 hours later.
Yeah. Okay. So what we're going to do, we're going to take a quick break because two of the other presenters for this session were on climate change and how it impacts the environment. But, life happens, and so we have to be flexible. We're going to take a quick break, commercial break. So go ahead, do some networking in the chat. And Sarah, we're going to give Sarah the opportunity. She's in Cairo, Egypt. So we will allow her to go ahead with her presentation earlier. It's actually due for session 13, but we're going to bring it a little bit earlier because we still have time in this. We have time and we want to make the best of time. We don't see two of the other presenters who should be during this session, Dr. Raga and Praise. Don't see them on the Zoom just yet. So we don't want to, we want to respect everyone's time. And so we're going to let Sarah go ahead a little bit earlier with her presentation. All right. So thank you. In the chat, just go ahead, do some networking, share in the chat what organization you have, and just share like a little bit about your work. What are you doing? What's your main focus areas? Some of you, you are into agriculture, you are into like youth advocacy, health advocacy. Just kind of drop the main projects that you're working on right now. Let's get all some engagement and interaction going on in the chat. Let's see what everybody is up to. Yes, and great job, Chitundu. Thank you so much for those great questions for our presenters just now. Thank you, Dr. M. Ngomzik earlier and Ms. Ciel who just presented. That was such an excellent presentation, very, very on point, very, very insightful. Thank you for all the solutions and the strategies that you just shared. Great, great engagement. All right, so we see Mohammed from Yemen. He's the official youth mechanism to the UN Environment Program. Welcome, welcome everyone. Thank you so much for being here with us, for sharing your time, your expertise, just making sure that you're adding your voice, your perspectives, you're engaging in these very crucial discussions. We have Miss Amelia Frederick. Hello, hello. Greetings. Thank you, Mohammed. Thank you. We have, yes. Let's see. Veti Algala. She works on health insurance, especially for the poor and vulnerable. Thank you so much for what you're doing. Also a public health physician, advocate for adolescent and women's health from River State, Nigeria. Shout out to you, Miss Veti. Thank you so much. Thank you, Mohammed from, where are you from, Mohammed? Don't see where you're from, but you said that you're a climate activist leading some 80-member group. You're a teacher, trainer, PhD scholar. Thank you so much for being here. Mr. Lukman Ibrahim, you work with sickle cell disorder advocacy. Thank you so much for being here. You're from Nigeria. The chat is blowing up. It's going so fast. I can hardly see it fast enough. Thank you so much, Habib. Thank you for your comments. Excellent presentation. We really appreciate. Yes, Lukman said he's from Nigeria. Thank you so much for being here. Emmanuel Clement, just want to shout out to you, working as a respiratory and cardiovascular occupational and gender and human rights activist, working on some nutrition programs for 5 rural communities in Nigeria. Thank you so much. Continue the great advocacy. Awesome, awesome stuff. I'm loving it. Justine from, where are you from? Geographer from Kenya. Shout out to the Kenyans in the house. Would love it. That person is working on climate innovations, currently have more than 10 innovations working on. Great, just wonderful. Sakoy Beya from Gambia. Welcome, welcome, Sako. I hope I get your name pronunciation right. Great. Thank you so much, everyone, for being here. Love the engagement. Welcome. Gloria Ansa, Juliet Ngozi. I see some faithfuls. You've been here since day one. Thank you so much for doing this journey with us. You are really dedicated advocates and activists, and we just love your dedication. Flora from, let me jump back in the chat. Yes, the chat is blowing up. I love it. Love the engagement. We have Martins Wasichi from Kenya. Wonderful. Let's see. We have Fasazi from Nigeria working on an app to assist addicts. Yeah, that's very, very important in the recovery process. Shout out to you. Wonderful. Yeah, that's really an area that is needed, helping people with substance abuse to recover, to get back to functionality and be productive in society. So shout out to you, Fasasi. Wonderful work there you're doing in Nigeria. Thank you so much, sir. We have Taribi from Nigeria. Lots of Nigerians in the house. Woot woot. Welcome, welcome. Flora from Nigeria, public health specialist. Love it, love it. Let's see. Afghanistan. Oh, wonderful. Samira Ahmadi from Afghanistan. Welcome, welcome. Afghanistan represented. Thank you. We have Juliana Okini, CEO and founder of Juliana Holistic Healthcare Services. She's Deputy Chief Physician, Public Health Manager, doing some surveillance there for non-communicable diseases and climate change advocacy. Where are you from, Juliana? Didn't see that, but thank you so much for being here. We have Amelia Frederick, advocacy work of Big Sisters. Thank you so much. Where are you from, Frederick? Amelia? I don't see it. Remember to drop your country. Yeah, we love the representation. We love the diversity. And so we want to know where everyone is from. Matua from Uganda. Yeah. Uganda in the house. He's a health worker working in a BD, can't call that word, sorry, refugee settlement with International Rescue Committee. Also a founder and executive director of organization called Skicend or SKICEND. Wonderful, wonderful. Thank you for your work, sir. Yes, glad to be doing these days with you also. We have Olumide Kemi Esther from Nigeria, social work, gender advocate. Lovely, lovely. Wonderful. We have Dr. Samson. That's easier. I'll go with Samson. State clinical mentor working on HIV or AIDS in far-reach communities in Nigeria. Thank you, Dr. Samson, for being with us this morning. And yes, thank you so much. Thank you so much. Juliana from Ghana. Thank you, Juliana. Thank you. Afghanistan, we have Miran Hamid. All right, wonderful. Thank you so much. All right, Miss Sarah Rashid, over to you. Are you ready now?
Yeah, I can begin now.
All
I will
right.
share my presentation.
Yes. All right, great engagement. Thank you so much, Sarah. You can go ahead. Thank you for all that wonderful engagement in the chat, everyone. Shout out to you. Thank you for representing young people, being a voice for them wherever they are and in your respective countries. And thank you so much for the work that you have. Yes, I know, Habib, Abu Bakar, yes, you've been here from day one. Thank you so much for continuing with us. All right, Sarah, you can go ahead and share your screen, share your presentation. Thank you so much.
Yeah, thank you so much. I'm opening it right now.
All right, great. All right, so we're still giving her some time for her screen to come up. We have Mohammed Alakjel from Yemen. Welcome. Miss Natasha's in the house. Natasha, welcome to Miss Welcome from New Jersey. Yes, such great presentations on day 1 and day 2. Thank you for Natasha for being here with us still. Wonderful. We have Vivian Promise from Bayelsa State, Nigeria, epidemiologist working on increasing routine immunization coverage. Yes, immunization is important. Thank you so much. It helps to prevent diseases like measles and all those things. So thank you so much for your work. You ready, Sarah? Share your screen?
Yeah, it's shared right now.
Yes, it's coming up now. All right, there we go. Thank you, everyone. Keep the emojis going in the chat for Miss Sarah as she does her presentation. Thank you so much. All right, go ahead, Sarah.
Thank you very much for allowing this opportunity to be with you. I'm Dr. Sarah Rashid. I'm lecturer assistant in Technological University, also ambassador for sustainable development here in Egypt. I'm CEO of a recycling company for textile wastes. Also, I'm researcher and reviewer for COP29 research papers or policy papers. Also, I'm a member of the Climate Finance Academy. I got my policy paper published in COP29. Actually, I'm going to talk about empowering change for health advocacy in the fight against of the global nutrition crisis. When we call health advocacy, what does it mean? I think it plays an important role in the global nutrition crisis. By raising awareness and promoting effective policies, advocates can influence change and improve access to nutritious food. I will explore the importance of advocacy, creating a healthier world for all. What are the nutrition crises that is around us? The global nutrition crisis affects millions worldwide, leading to several diseases. We have factors such as poverty, climate change, food insecurity contribute to this issue. When we understand these challenges, it's really essential for effective advocacy and creating sustainable solutions. When we look at the role of health advocates, we have to see that health advocates are vital in promoting policies that address nutrition. They raise awareness, mobilize communities, and collaborate with stakeholders to create impactful change. By leveraging their expertise, advocates can ensure that nutrition is prioritized in public health agendas. What are the strategies? What are the strategies for effective advocacy? Successful advocacy requires a mix of education and community engagement with the public sectors, private sectors, utilizing social media, organizing campaigns, and partnering with local organizations. Advocates must also focus on evidence-based approaches to influence policymakers and stakeholders. We have here case studies of impact. When you examine successful case studies, reveals the power of advocacy in transforming nutrition policies. Initiatives that have led to improved access to healthy foods and increased public awareness serve as models for future efforts. Learning from this experience, it's really essential for ongoing issues. What is our role as youth policymakers and decision makers? When we look at the call to action, I think that empowering change through health advocacy is essential in the fight against the global nutrition crisis. We must unite our efforts, share knowledge, and advocate for policies that promote access to nutritious food for all. Together, we can create a healthier future. And thank you very much for this opportunity to be here with you. And this is my contact in case of you have any questions. Thank you so much.
Thank you so much, Ms. Rashad, for such a great presentation. Wow, that was just really short and to the point. Wonderful. Just go ahead and drop your questions in the chat for Sarah. If you have questions in the chat, we can definitely take those now for her. And this presentation is about like nutrition, but certainly our food sources, yes, are impacted by climate change and by a lot of the things. So we can definitely still tie in the whole climate change conversation with the nutrition and how that impacts our body, with all these natural disasters. Yeah. Like Sarah, since we are still, in the climate change segment, how would you say, for example, natural disasters such as flooding and hurricanes and Many of us are familiar, well, in some regions of the world, there's like volcanoes. What's the impact, the effect that these natural disasters have on our nutritional, and food sources? You wanna just share?
Yeah, it's really dangerous when we look at the agriculture in the most regions that is impacted by floods or drought. Actually, you know that fruits or vegetables are really burned due to the impact of climate change. So what we have to do, increase our initiatives as youth and policymakers, and collaborate with researchers and businessmen to get funds. Also, we have to search for the dangerous problems in order to get sustainable solutions. For example, I think that when we look at COP27 agenda of Sharm el-Sheikh, there were solutions for hydroponic agriculture. Hydroponic agriculture is a really sustainable solution for cultivating vegetables. It can resist the temperature or the rise in the global warming that causes increase in temperature, and you can get sustainable and organic food that you can get it all over the year. So this is the most really sustainable solution that you can get in the field of agriculture, and to get rid of the impact of climate change that really affects the soil, especially the soil and the the fruits and vegetables. So we can have food resources, maybe healthier food resources. Also, when we look at the food wastes, we have really this is too important. We have to get the idea of recycling for food wastes to get other maybe sustainable products. This is really good.
Absolutely. Recycling is very important. And, I love that you touch on that. I do have another question. Go ahead, everyone, delegates in the chat, drop some questions, drop some feedback, some love, some emojis for Sarah Rashid. She did such a great presentation. So definitely let's engage her further. In the meantime, what would you say are the most effective approaches to advocating for better nutrition policies and programs? Sarah, how can young people approach their government and say, hey, put these programs in place? Give us some strategies there.
First of all, we have to look at the problems that is surrounded in our society. After this, we have to do policy paper to address the most dangerous problems. So we have to make some partnerships and collaborations with researchers, because they are the most ones that are aware of the problems that are surrounded to them, and give solutions that is related to the industry and to be costless. So I think that when we do that, we have to make initiatives by youth. When we have initiatives that spread awareness about the nutritious crisis, I think this is more important to spread the awareness among people. Also, after spread awareness, we have to collect the ideas and solutions by youth that are surrounded to us and implement it. When we implement it, we have to collaborate with the private sectors and public sectors. So we have to make connections. We have to be in partnerships. By the way, all over the world, not only in our country.
Yes, that's such a great point you've raised about networking and partnering. It should definitely, when we're advocating for each other and the issues that are most critical to us, it has to be about collaboration over competition.
Yes.
Nobody wins.
To achieve the sustainable development goals. Yeah, win-win situation. Yes.
Yeah, absolutely. So I love that you've mentioned that. All right, another question for you. How can advocacy efforts ensure that solutions are equitable, inclusive, and culturally sensitive? Yes, that's very important too. We had that conversation about being culturally sensitive, understanding everyone's language, trying to speak and communicate, you know, at a level where everyone can appreciate. So how important is that to the conversation of nutrition?
I think it's really very important because I think that we all are of different topics or categories. We are not every one of us is specialized in the nutrition. We are from different categories and fields. So I think when we are different, we have to, together. By the way, when different ideas gather together, I think that we have or we must reach other new idea and novel idea. So it's really important, regardless our differences like communications or languages. But when we have a goal and we are running to reach it, I think it's really maybe we have to be flexible. By the way, we have to be flexible and respect each other's ideas and thoughts. So when we do this or change our behavior, I think that we are able to achieve our sustainable development goals, like reaching the more sustainable solutions. So I think that we have to collaborate. This is the most important point. This is the most important point. Really, we have to collaborate regardless our differences.
Yes, one wonderful response. Thank you so much for that. I'm still checking the chat. Any delegate, anyone there has a question? Michelle, Mirabelle, Analu, she says, great presentation. Thank you so much for that feedback, Mirabelle. Any questions for Sarah? Let me find another question for you, Sarah. How does the global nutrition crisis intersect with other public health challenges such as climate change and poverty? And I know you were mentioning a little bit about it, but you can still add something to that. So how does the global nutrition crisis, and we really need to talk a little bit more about that because of the whole climate change situation, you know, these natural disasters, as we mentioned earlier, they are causing starvation and hunger crises in a lot of places. For example, even the war in like Gaza now, in Palestine. I know these are, you know, very sensitive issues, but they're going on in our world, so we can't put a blind eye on them, right? And there are other places like Sudan and, you know, a lot of countries that are ravaged by war and, you know, a lot of climate change issues on the ground. So how you know, what's the conversation? What are some of the solutions maybe to reach people who really, you know, with just being affected by, say, the war, what's going on in their country, and, you know, the whole climate situation, hunger, food hunger on the ground?
Yeah, when we look at this topic, I think this is really very interesting topic and sensitive because this is the role of peacemakers. Peacemakers should calibrate together all over the countries and put an end to the war, because when we look at war, what's the target of war? War just led to peace. By the way, there are conflicts. Why there are conflicts? Just to reach the peace. Okay, when we look at this, we have to stop war because countries all over the world have the right to live peacefully. Actually, children, when you look at the children are the most category that has negative impact, by the way, or they are affected negatively. There are no resources, you know, child in his earlier age, he has to eat very healthier food, by the way, but in order, food resources are just maybe there is no food resources because of war, so they are not eating, they are not getting the you know, the good vitamins, proteins, carbohydrates. They just take food from other countries and not sufficient. So this is not good because they are building society of a weak of weak people and maybe mentally and physically. So this is very dangerous, by the way, for the world later. So we are raising up weak people. He will not. These people will not influence their country or the world. By the way, this is the first point. So the second point, when we look at the food resources, they are just getting it from other countries because they don't have. So the reason they are affected by climate change, like floods or drought, they are affecting by wars, and this is not good because they don't have the rights. So when we look at the role of human rights institution, they should put a plan to stop this, because every one of us has the right to live peacefully and get his healthier food.
Yes, yes. Great, great response. Thank you so much for that, Dr. Sarah Rashid. Thank you so much for your presentation today. It was just extremely, very timely, very pertinent topic. Thank you so much. We are going to be getting ready for our next session. Thank you so much. Continue the great advocacy work that you have been doing. We just really, really appreciate you being a part of this forum. Thanks, and stay safe in Egypt there. All right. So Mohamed Ishmael is our next moderator. And we are going to be going into our next session. Let's see any comments from the chat. Musa says, yes, it is a very important topic because, right, world hunger, poverty, malnutrition is increasing. Yes. And, as Sarah says, with war, nobody wins. What's all this war about? We really have to be advocates for peace in our communities. It starts peace within ourselves. If people are constantly in turmoil, internal turmoil, then that also will translate to the larger society and the world. So we really, as individuals, have to resolve to be peacemakers, and that peace has to first start with us. Yeah. And then we advocate for the world peace, for the global peace, because nobody wins when there is war. So great presentation, Miss Sarah. Thank you so much for really, and later on in the day, we will come back to the nutrition conversation. Yes, yes. Thank you so much for your participation there in the chat. All right, I see our moderator for the next session. We have one presenter. Let's see if that presenter is available. Session 11 is going to be dealing with global collaboration in the health sector. And our presenter is Bukhari. Is Bukhari on the call as yet? Let's check. If you're on the Zoom, Bukhari, Zelia Bukhari, just raise your hand so we can bring you to center stage. I know Mohamed is here and he's ready to take that session away. But is our presenter for that session here as yet? Let's see. And also, we're doing very good with time today, everyone. So that's great to know. We may even end the day early today. Let's see, because we are doing really, really well with time. So that's great. So let's see if there were two presenters earlier. So, we still have some of their time to spare. So yes, great presentation. All right, I don't see Bukhari, who is the keynote presenter for this next session. That person hasn't quite joined us yet because we are ahead of their time anyway. So maybe, they're in the middle of their work day and some persons have to just try and get on like just before their session. So I know that that might be what is happening, but we do have some time. So go ahead and get some engagement there going in the chat. Make sure you are networking. Your network is equal to your net worth. Yes. Once you add value to other people's lives, once you connect, don't just be friends on social, but truly connect. Make important connections with people. Make sure that after this conference, you are networking and you're collaborating with each other on a genuine way, or in a genuine way, I should say rather. Yes, because network is equal to net worth. That is how, you know, income comes as well. You share value, others share value with you. Everybody wins, everybody earns and makes money, and capacity increases. So make sure that you're expanding your networks literally, because that's how your network is also going to be increasing. But I love the engagement. Yes, we still have some time, and I don't see our presenter for this next session as yet. Bukhari isn't here just yet. Raise your hand if you are. But I know our next moderator is here. Mr. Mohammed Ishmael is here. So let's see. But nope, Bukhari isn't here yet. That session is actually scheduled to begin at 1610 UTC. 1610 UTC, Global Collaboration in the Health Sector. And it is, so 20, we're almost ahead of time by 25 minutes. So that's how good we're doing on time today. We're 25 minutes ahead of the next session. Yes, and 45 here. And our next session is to start at 16:10 UTC. So we're doing great on time, everyone. In the meantime, let's get some, you know, cardio going, some exercise in. We're gonna take a commercial break literally for about 10 minutes, and then, or maybe our keynote for that session will be on. But continue the great engagement. Don't go anywhere. Let me give some more people some shout out in the chat. Let's see what's going on. Toshi from Nigeria pursuing a doctoral degree in public health. Let's show some love there. Ooh, ooh, ooh. Thank you so much for being here, Toshi. Yes, thank you, Pira. You know, somebody was telling the other presenter, CL, they want to connect and collaborate. Make sure you're collaborating in the delegates group, in the speakers group. Natasha there sharing her business card. Thank you, thank you. Faith Wu Sigo, thank you for your comment. Thank you. Mohammed, thank you for your comment. Greetings to the presenters, organizers, attendees of this important and fruitful World Exhibition Conference 2024. Thank you so much, Mohammed, for that comment. Let's see, some more shout outs in the chat. We have, let's see. Yes, we have Flora from Nigeria Public Health Specialist. Thank you, Flora. We have Taribi from Nigeria. I tell you, the Nigerians are taking over the house today. Thank you so much. It's a TGIF. It's Friday. Everybody's free in Nigeria on a Friday. Thank you for being here. All right. And then we have Vivian Promise, epidemiologist. Yes, thank you, Vivian. We have Who else we have? We're shouting, like we're doing some shout outs right now, because we have some time on this Zoom until our presenter, some other presenters join. We have Onyika. Onyika is joining from Toronto, Canada. Thank you. Welcome, welcome, Onika. She is originally from Nigerians. I tell you, the Nigerians are representing. We're outnumbered, world. I love it. It's okay. It's all right. It's all right. Much love from Nigeria. The Nigerians are taking over the house today. We love it. All right. We have Victor from Ghana. Ghana in the house. Yay, yay. Thank you so much, Victor from Ghana. He's the Director of Health Services, District Director of Health Services there in Ghana. Thank you. Thank you. We have Uluchi, Mildred. I got the Mildred part right. But Oluchi from Nigeria. Ooh, I tell you, the Nigerians are in the house today. We have Elidad from Ghana, physician assistant. Welcome, welcome. Thank you so much. We have Blessing Onia. Not sure where you're from, Blessing, but thank you for being here. Samson Ifiri, thank you so much for being here. We have Levis Ayuko from Kenya, for your student. Thank you so much for being here. We have Paul. Paul, I cannot pronounce your first name. It looks beautiful though. Thank you for being here. Thank you for your comment. A very interesting presentation. Well done. Yes, yes. Thank you so much for that comment. Great presentation. Really bright benefits from global nutrition. This is Sako from Gambia. Wonderful. Welcome. Thank you for being here. Thank you, Jonathan Osigbo. Thank you for your advocacy and your comment as well. Thank you. We have Jibril from, where are you from, Jibril? Not sure. All right. We have, I can't pronounce that name. Wow. Anyadi. Okay. Anyadi from Nigeria. Welcome. We have Chinwendu Davies. Yes, that's easier. Chinwendu Miracle. I love these names. A registered nurse, registered public health nurse from Nigeria. Welcome, Chinwendu. Your name is beautiful to pronounce. Abba Ibrahim from Nigeria, PhD candidate. Thank you. Welcome for being here. Martins from Kenya. Wonderful. Kenya Youth Organization. Up, Nigeria. Yes. Oh, Jibril is from Nigeria. All right, great. Thank you. Yes. You are plenty in the house today. Love it. We have Tola Theophilus from Nigeria. Yes, I tell you, plenty in the house. A lot of my nursing instructors were from Nigeria, so I love it. I love Nigerian food. I love the lingo because you have your own unique dialect and like ours in Jamaica. I'm originally from Jamaica. Amelia from Liberia. Okay, thank you for sharing that, Amelia. Welcome, everyone. Thank you so much. All right, so as I said, we are really good on time today. We are going to start our next session in about 10 minutes, 1600 UTC, which is 1600 UTC. Yes. So we're still good on time, which is 11 a.m. EST, my time. So, and it's 10:51 a.m. here. So yeah, so we're still doing really great on time. All right, so I'm gonna kind of share some music, get a little bit of cardio in, and then we can rejoin in 10 minutes. We'll go into the next session. Hopefully we'll have some of our keynote presenters for the next session on the call in 10 minutes. Let's see. Still don't see any of them as yet, but our moderator for the next session is here. So that's great. Yes. Still just checking, still just making sure to see if any of our other Suleiman Sani is here. Yeah. Where are you from, Suleiman? Just drop some. I see Kim from Ghana. Kim Albert, welcome, sir. Looking forward to your Vibes Master session later today. Yes. So, okay, Suleiman from Nigeria. You see, I tell you, we're outnumbered here today. Oh, hello, please. We're outnumbered by the Nigerians today. But it's okay. Love it. All right, so let's get a little bit of exercise, a little bit of cardio going. We're gonna